On the Central African Republic's northern border with Sudan, the hospital in Ba has only 60 beds for a local and refugee population of nearly 40,000 people, according to Bel Trew reporting for The Independent, and the hospital chief said they can barely cope with the influx of refugees. The scale is a border facility built for a sparse town now carrying a population the size of a small city, with 60 beds covering close to 40,000 people who depend on that single ward. The Central African Republic already had one of the highest maternal mortality rates in the world and was dealing with internal conflict when war erupted in Sudan in 2023, according to The Independent. Since that war, the number of pregnant women needing services at the hospital in Ba has more than tripled. At the same moment, aid cuts stripped the capacity to absorb them. All the midwives were let go, leaving Assistant Deline to manage all consultations alone, and at Barau's refugee camp, UN mobile maternity clinics were dismantled when funding was cut. Displacement that began in 2023 has not reversed, but the points of care that could have diverted patients away from Ba were removed just as demand surged. Basina and her family fled Darfur 3 years ago on donkeys, and she said armed groups murdered her husband and attempted to rape the women, according to Basina via the report. Amna, a Sudanese refugee, lost her baby at 9 months and nearly bled to death. Both cases trace the same line from violence during flight to a maternity system without staff or mobile clinics to absorb the surge. The contradiction is that need tripled as care points were removed. A border hospital with 60 beds now funnels deliveries for nearly 40,000 people with no midwives and no UN mobile clinics at Barau to ease the load. And what remains unresolved is whether funding and staffing will be restored to match a displacement that started in 2023, or whether deliveries will continue through an overstretched hospital already at its limit.